Our next clinician who's going to speak is Dr. Claudia Mosier, who's been a trailblazer throughout her life. She's a licensed clinical psychologist in Illinois and Louisiana, a medical psychologist in Louisiana, and a prescribing psychologist in Illinois. And the population that you most work with is the LGBTQ plus community, and you have expertise in treating patients with chemical dependence and severe trauma and histories of interpersonal violence, HIV, serious mental illness, and those in need of gender-affirming care. In the summer of 2021, you were elected to the LGBTQ Hall of Fame. Congratulations. Dr. Mosier's done groundbreaking work with the gender-affirming surgical team at Weiss Memorial Hospital, University of Chicago system. And for the last 7 months, in addition to your private practices in Louisiana and Chicago, you've been prescribing as a prescribing psychologist at an FQHC in Chicago. You're treasurer of the Illinois Association of Prescribing Psychologists, and you're going to be speaking about your fabulous work. So thank you.
You know, none of this would be going on if it wasn't for Beth, because she came to DCFS and talked about prescriptive authority for psychologists and inspired me and got me to start going on that path. And life has changed since then, and I can help my patients so much better than I used to be able to. So often helping them understand medications, deprescribing medications, encouraging people to try medications, all the while doing, you know, individual psychotherapy. I don't do a lot of group work right now. But in Louisiana, I'm now an advanced practice medical psychologist, and so that gives a little bit more freedom. It's closer to what we have in Illinois, where I don't have to, in Louisiana, before I was advanced practice, I had to get a concurrence letter from a physician in Louisiana. But once you're advanced practice, you just have to send them one progress note every year. But here's the cool thing about being at Bobby Wright. Bobby Wright Community Mental Health Center is on the west side of Chicago, and most of the people there are extremely poor and have not had the best medical or psychological care. And what Mary was talking about, the importance of embedding with medical care with psychological care, I do it every day at Bobby Wright. I mean, just a simple thing of I insist all my patients have their vitals taken before they see me, and I keep a track as to how they're doing. And so many of the patients have been prescribed medicine for hypertension, but for whatever reason they're not taking it. And part of my job is to help them understand why it's important to take it and to look and see what barriers are. And one of the nice things they do at Bobby Wright is the counselor is in the room with me as well. So I've got the counselor in the room. You know, I'm working primarily as prescriber, but you never take the psychologist out of a prescriber that's gone through all that we've gone through. And working to find out ways to get them to feel more comfortable, because if they're not going to take their hypertension medicine, they're not going to take medicine that I prescribe. So I'm doing double duty by encouraging them to pay better attention to their health. I'm thrilled working at Bobby Wright. Sometimes you would think, because I'm an old white face, and I look very different from my patients and from the other staff there. But, our basic things that we know of psychology, to understand people's culture, to meet them where they're at, to listen to people, it's amazing how those barriers fall down and people are willing to talk and willing to let me try to do the best that I can to help them have better quality life. So none of this would be happening if it wasn't for Beth Romreimer. So vote. If you have not voted, vote right now.
It takes a team. It takes a community and a team. Thank you.